Here for what is now our every twice a month. But I am in a place that's a little bit noisy, so I'm going to mute when I'm not talking, and I'm going to hand this over to Amy, just going through our usual CME, no disclosures, reminding we're now on the second and fourth weeks of the month. Next one will be fourth week. And we're going to talk about 12 to 15-year-olds and some changes in state distribution. So I'm going to mute Amy, let you take.
Good morning, everyone. As you probably saw yesterday, the FDA approved the Pfizer vaccine for 12 to 15-year-olds, and last night, the Maine CDC as well authorized it for 12 to 15-year-olds. And so as of today, sites in Maine can give Pfizer for the 12 to 15-year-old age group, which is welcome news for everyone. There are some specific issues to vaccinating youth, which the state had outlined last month with the 16-year-old and up guidance, but just to remind you that you do need parental consent for the 12 to 17-year-olds. ID is no longer required. A parent or guardian can attest to the age eligibility, and there is no longer a residency requirement in the state. It is recommended that youth have a parent or guardian present, although this is not required, and we know that there are a lot of sites that are gearing up to do vaccines at schools next week. And so a parent or guardian is not required as long as they've provided consent ahead of time. Just a note, when you are getting consent, you should have an emergency phone number on the consent form in case they have some type of reaction. The Maine CDC is working to gather the sites who are offering Pfizer vaccine to put on the state website. And they did send out a notice overnight. I think some of you may have gotten this morning asking that people notify them who are able to give Pfizer vaccine. And the youth who are 16 and older can ride in the Modicare contract to get a ride to a vaccine site. If they're under 16, they would need to ride with a guardian. So you need to get parent or guardian consent, which can be by phone or electronically or written. May give their own consent, including those who live separately from their parents or guardians and independent of parental support. Those who are legally married, a member of the armed forces, or emancipated by the court. If DHHS is the legal guardian, if the child is in foster care, the resource parent can provide consent. Youth must be informed of risks and benefits, must be involved in the decision to receive vaccine. If there's any questions, the youth about this, they should be directed to the DHHS youth caseworker. And in most cases, the resource foster parents and or DHHS should accompany the youth to receive a vaccine, especially if they're outside of the school setting. One thing just to note, and this is something that they saw with the FEMA mobile van, is that they did have, as they brought the age down, some anxiety-related and post-vaccination syncope when they were giving shots with the mobile unit when they went to 16 and they went to 18 and up in the mobile unit. They were offering J&J Moderna. So just to note, those of you who give vaccines to adolescents, you tend to have a few more folks who are anxious. They may have, they may faint. They may have some vasovagal reactions and feel lightheaded. This has been noted with HPV vaccines in the past. The MMWR did note a cluster of syncopal events at 5 of the mass vaccination sites offering J&J, which they've attributed to anxiety and vaccine-related syncope. So the mobile unit in Maine started stocking juice boxes. They encourage pre-visit hydration. And they're just watching for those who may feel lightheaded, may feel faint. You should probably have a place that you've identified where somebody could lie down if they're not feeling good. Generally, people recover within 15 to 30 minutes and they're doing better. They're given the drink. They're able to go home. We just want to remind people as you're getting into the younger age groups that this is likely, you may have a case of this that happens and it's not unexpected. You go to the next slide. So the strategy for Maine is really to vaccinate as quickly and equitably as possible. Last week, there was guidance from DHHS encouraging the vaccine providers to work directly with schools. You can now organize special clinics for students and families, either at the school, at your vaccine site. I know some of the independent pharmacies have also been organizing this in their locations. Obviously, the vaccine needs to be Pfizer for the under 18-year-old group. And MIP is also reaching out to primary care practices that could potentially store Pfizer, or in some locations, they're using a hub and spoke model where a primary medical center may be able to provide Pfizer to those sites. We know some areas are hosting drive-through clinics, school-based clinics, but you still need to get parental consent. Of note, pharmacies can immunize children 3 and older during the public health emergency. This was done back in November and December. The state issued guidance, as well as the federal government has guidance based on the PrEP Act. Right now, with most of the federal pharmacy chains are getting vaccine right now in the state. Walgreens is the only one consistently getting Pfizer. There are some independent pharmacies that are getting Pfizer and are offering special clinics. But when you go to sites like Vaccine Finder and other sites, Walgreens is probably the only one that's consistently getting Pfizer at this point for this age group, but there may be other pharmacies that get this over time. The big thing is we're asking providers to really educate youth and families about the importance of the COVID-19 vaccine, and identify places where they can get connected to vaccine in their community, and you can partner to sign up either with one of the pharmacies or one of your health systems or sites that are offering Pfizer already. We're still looking for really good social media and other sites encouraging youth to get vaccinated. We're expecting that there's going to be some more national materials coming out this week. There's been a couple of studies around adolescents' interest in getting vaccinated, and this one was the Journal of Adolescent Health. They looked at 14 to 24-year-olds, and about 75% were willing to get vaccine, 42% unconditional willingness, and some, about a third were conditionally willing to get it. They really wanted to receive it when they believe to be safe. They want to protect themselves, protect others. They want to get back to normal. Because it's had some 18 to 24-year-olds, some of them must get it for their job. And they're really looking for information from medical organizations like the CDC and the WHO and their medical providers. I think the concerns that we're hearing from youth are really side effects and efficacy. As we're listening to other talks across the country, a lot of kids just want to get back to normal. Teenagers want to go to graduations. They want to go to end of year activities. They want to play sports. They don't want to be quarantined all the time. They want to feel like they are protecting themselves. And many of them want to protect family members who have chronic medical issues or older family members. And so I think there is generally, we're hoping to capture this willingness in the first part, knowing that we're going to, as we move along in the summer, have some that are less willing or families that are not as interested in the vaccine. But I think that there is a lot of children who are very interested in getting vaccinated as soon as it's available. Go to the next slide. One thing that we are reminding providers about is the US CDC currently recommends that people wait a minimum of 14 days before and after COVID vaccines. That puts us sort of in this 7-week blackout period, 2 weeks before, the 3 weeks with the doses, and then the 2 weeks after. And so we're really trying to remind people to, if they're going to start now, that is great, getting Pfizer. And if they need school vaccines before the start of school in the fall, that they can get those later in the summer. We are waiting. Pfizer has said that they're applying for the 2 to 12-year-old vaccine emergency authorization in September. So we want the younger kids under 12 to get vaccinated with their childhood vaccines before school now, and the older kids to get their Pfizer and get their school vaccines, in August before school. So we're just wary of that time period before and after vaccines. It is noted that our state law PL 154 does go into effect September 2021. That removes the religious and philosophical exemptions for school vaccines required by schools. We are still waiting for the rules and guidance to be written and approved for this law. But right now, COVID is not on that list of mandatory school vaccines. I did want to note for you that the AAP in the state has worked with the professional groups on this request for medical exemption for mandatory immunization forms. You may have seen this form. They're working with many of you on this, and that is available. But right now, COVID is not a mandatory school vaccine. There are a lot of sites that have information on vaccines for youth. One is down at CHOP, has their Vaccine Education Center. The Maine CDC is doing videos with providers discussing COVID vaccine, and they will be producing one with some local pediatricians soon. They do now have a Facebook page where they're answering questions. And Maine Care does have a vaccine sheet for the 16 and 17-year-olds, and they're working on updating it for the 12 to 15-year-old age group. The AAP does have some materials on vaccines for families. I'm hoping in the next 2 weeks, we're going to see a lot more social media targeted towards this age group. I've seen some local news stories, and we're kind of waiting for that next wave to come through to really target youth. You go to the next slide. So on the last night, they updated the Maine eligibility page. So now individuals 12 and older can get vaccinated. You can go to the next site. And I'm going to turn this over to Lisa, who's going to talk about physician practices now can order COVID vaccine directly from the Maine Immunizations Program.
Yeah, thanks, Amy. So really great timing. In addition to now the younger age group being approved, last week we had the Maine CDC change their process so that any MIP, Maine Immunization Program approved COVID vaccine provider can now order vaccine. So it was announced on the by email to anybody who is an approved vaccine provider, excuse me, specifically a COVID vaccine provider. There's a difference, right? It can't just be any vaccine, COVID vaccine provider. And then on the vaccine work group call on Thursday. So I've got links here, and again, these links are always clickable if you download the slides once we post them. But there's a memo that outlines the request process, and then there's a weekly allocation form. They're not yet using Impact to order, so practices that want vaccine have to use that weekly allocation request form. It has to be submitted by email by 5 o'clock each Monday. The previous expectation that practices would distribute all the vaccines within X period of time, whatever that was, 7 days, I think, that is gone. We just ask that they be distributed within the confines of the distribution and storage requirements, which is, I believe, 90 days for J&J and 30 days unfrozen, thawed for Moderna, but the specifics are all in the provider fact sheets. The ability to order does not mean you get everything you ask for, but I think, with this loosened requirement, hopefully practices can find a way to participate. And now with Pfizer, obviously that requires the ultra cold for storage, for freezer storage, but it can be kept refrigerated for some period of time. Additionally, as we see rising levels of, hesitancy or just fall off, I should say, in demand for vaccine, we continue to promote other methods such as the health equity PopUp Clinics. Posted a link to the online application if you have any community groups. And we do have this really interesting new zip code level data. That could probably be a whole presentation. Actually, I think we're going to try to host a special webinar with MMA, MOA, primary care, MHA, to share that with providers more widely. But really interesting data from Maine CDC that is posted. The link is to files downloadable on the Maine CDC website, showing right down to the individual town level, towns that have significant proportion of population who are not yet vaccinated. So we continue to promote that as use of that data and the use of the pop-up clinics. Just a plug again, we'll be holding our equity webinar. Gosh, is that next week already? Focusing on efforts to message and communicate, engage youth in particular. Just an quick update on the FEMA mobile van. We continue to run that through communities in rural Maine. It's currently in Waterville with J&J. It'll go back to Oxford and Wyndham, where Moderna was used during the J&J pause to try to get people for their second doses. And then it heads up north, Old Town, and does a big sweep up north and down east before coming back to Lewiston. Remember that you can encourage patients to get it either by scheduling a vaccine, or now it's available by walk-up. And then there's a whole new unit. Now you may have seen a news release last week through an organization called ProMerica that has contracted with the state has contracted, and in partnership with the city of Lewiston has another mobile unit right now that's parked in the Oak Street Municipal Lot. You've probably seen Androscoggin County has really been the site of a lot of cases in the last couple of weeks. So trying to add additional resources there. They are offering Moderna at present, so it's for 18 and older. And similarly, they take either walk-ups or can schedule appointments. They're planning to move that ban to other sites in Androscoggin County in Western Maine in the coming weeks. And then just a reminder, we've always got the community vaccination line available to help people schedule and the transportation. In addition to the mode of care, there's also discussions ongoing with Morehouse School of Medicine that has a partnership with Uber, and we're hoping to be able to soon offer Uber coupons for more immediate transportation options through some of our partnering community-based organizations. Information always on the website, as Amy noted, that's been updated to 12 and older. And just a reminder again for anybody who joined late, we're now holding these sessions twice a month on the second and fourth weeks of the month. So with that, we'll break. I'll stop sharing for questions. Anything teed
Thanks,
up?
Lisa. So one question was about, will it be required for school? Well, the first part is that they need to get regular approval, which Pfizer is in the process of applying for. But this will be a legislative action that takes place. So I'm not sure when it's going to be part of that requirement. There's a process that needs to take place for that. The next question from Lisa Belanger is, can you address the issue of international students arriving in the fall, WHO versus FDA approved vaccines? Is it okay to revaccinate an individual who's been vaccinated with a non-approved vaccine? That's a good question. I don't know the answer. I don't know, Steve, if this has come up.
Yeah, that's actually clearly stated in a CDC document, which is it's called Interim Guidelines for COVID Vaccination. I'll try to find it if we have a minute or two. There's a section that specifically says that if someone has started a vaccine series overseas and has not completed it, then you would need, and it's a non-US authorized vaccine, you would need to then start the series. But if they come with an already authorized vaccine from WHO, and those are on WHO's website, but generally the ones that people are mostly having to deal with are AstraZeneca, since that was used pretty widely in Europe. And if someone has completed the AstraZeneca series, which is 2, they do not need to be revaccinated. But I will try to find that, but it's in CDC documentation really fairly clearly now. They just put it up probably 5 or 6 days ago.
Next one, Steve, is Pfizer known to be effective with the Indian variant? Has it been tested for it?
The Indian variant is now called a variant of concern. It's been upgraded from a variant of interest. It's called B1617. And I think there's another one too. And I haven't seen any data specifically. This was a recent publication within the last week or so in the New England Journal about B1351 and P1, Brazil and South Africa, which it does appear that the vaccines are, although less robust, they still are effective. That is what the expectation is, although they just aren't, it's not a population study. Most of this is done in very small, either in laboratory and or in small populations. But from everything that it looks like, it's expected the vaccines will probably be effective against those. But, when I say that, that's as of like today, because these variants continue to mutate over time. And that's one of the 3 concerns really are, is it more virulent and is it more transmissible? And then does it get covered by vaccine and or monoclonal antibodies. Those are ongoing issues that continue to be monitored at this point. It does appear that the Indian variant is clearly more transmissible, which is probably one of the other reasons why we're seeing such devastating disease in India.
Those are all the questions we currently have in the chat box. I see Dr. Panoia is on. Dr. Panoia, I didn't know if you had any updates on your end in terms of management of allergic reactions, anything new on your side?
I think that the testing is available for polyethylene glycol through allergy practices in Portland and in Augusta, as well as Boston. And just reminding people who, if they have a patient who's had an immediate allergic reaction within 4 hours, that they should get them either referred to an allergist, or they would go into a precaution group and receive the Johnson & Johnson vaccine. But we don't want partially immunized individuals. So people should just be aware that there is a good way to get them evaluated and complete the series.
Great. Thank you, Dr. Panoia. Dr. Sears did put in the link from this, well, the information from the CDC for folks. I don't know if Dr. Sears, do you have any other words of wisdom?
You're asking me to do something at the same time I'm trying to find a link, and I can't do two things at the same time.
Well, I don't know. I'm going to Lisa then. I don't see any more questions. But
Well, let me just I'll put the link in. Actually, I put the specific information. No, I think it's, the only other thing I would say is it looks like Novavax will probably be going for EUA in the month of May towards June. Novavax will be the next of the vaccines that will be being considered. It's different than the other vaccines we have. It's a protein. It is the spike protein that is then bound together in a material that just presents the spike. It appears to be effective in similar rates to everything else, but we'll have to wait till we see the EUA. But I would expect it probably in the next 2 to 3 weeks.
great. Well, it's going to be an exciting, busy week for all of you who are working on the vaccine front lines as we try to get more of the 12 to 17-year-olds vaccinated in the next few weeks. Especially, I think the goal is to try to get at least a round in before the end of school. I want to thank everyone who's doing all of these clinics, either getting them to their larger sites or going out to the schools. It's a lot of work, but we appreciate everyone's efforts. And we know that there's still a lot of work to get those who might be hesitant to get vaccines. So we appreciate all the work that you're doing on the front lines. So I'm going to close this up, and the recording will be available on the Maine Immunizations Program website. And we appreciate everything everyone's doing. So thanks very much.
Great, thank you, Amy. And oops, got one more. Is Novavax a single dose or a series?
It's a series, I
Single.
think.
Is it?
I think it's a 2-shot, but that's a good question. We will try to make sure we have the correct answer rather than just the one that comes top of mind.
Okay, so we'll be back on May 25th. Thanks everybody for joining. Thank you, Amy. Take care. Bye-bye.